one of the keys to improving hormones is that you need to supply them with a steady amount of fat. So on the ketogenic diet, you'll hear me talk about my dad and you'll hear me talk about my mom. As you age, the amount of fat-based hormones all decrease. It is even more of a decline of the production of these hormones when you have a low-fat diet versus a high-fat diet. So on this slide here, I just draw out several of these little here is cholesterol, which again, folks worry about their cholesterol getting higher on a ketogenic diet. Yes, it changes on a ketogenic diet. The word cholesterol stands for several words, but to say that your cholesterol is going to get worse or better on a ketogenic diet is too simplistic. Your cholesterol is going to change. Cholesterol is a molecule that shuffles the fat-based hormones around. It is the carrier of fat. It is also a supplier of these other types of hormones like cortisol, testosterone, vitamin D, estradiol, otherwise known as estrogen, and progesterone. There are more than this. The growth hormone's one of them, and I could go on several minutes about that. When you look at John's history, he has had a low vitamin D, and he also has had a low testosterone. This happened when he was in the depths of struggling with his sleep apnea. His mind was, foggy from the undertreated sleep apnea, and then they found that his testosterone was low. I would contend that it was probably a major part of being a metabolic syndrome. Again, that testosterone gets very low. When you increase the amount of testosterone in a man, which is what they did they overrode his body making the testosterone and they started injecting his testosterone. Unfortunately, when they get too high of testosterone in a man and the body's not really in balance for that, it will inappropriately stimulate the estrogen to increase as well. I'm just going to show one more slide of this. So if you look at the different places where this little mitochondria is in the center of this and the cholesterol goes in, as the mitochondria pumps out pregnenolone and then the 25-hydroxycholesterol, the pregnenolone turns into several of these other hormones, including the progesterone, your aldosterone, there's that cortisol and cortisone. And then in the gonads, it turns into the DHEA and again the testosterone, which also can turn into the estradiol, which is it's estrogen, active estrogen. So as you watch what happens inside a man when we replace testosterone, it's not uncommon for him to have an increase in his estrogen levels as well. And there's one more slide I just want to show you. Which just kind of represents when you look at hormones in the system of a ketogenic diet versus a non-ketogenic diet. I like this. So this is really looking at those fat-based hormone signals. And again, when you're on a standard American diet, you send out that signal and they get this little blurb of this little blip in their hormones. Unfortunately, it's like 25% of what is predicted for the pulse of that hormone. And again, these fat-based hormones are very much pulsatile in nature. They like the peak and valley. That's how our systems work. And so when they're on a ketogenic diet, as those hormones get more robust and the supply of fat is more predictable, you can find that they do get a much better surge in their hormones. It doesn't happen overnight, but it does eventually become quite an impressive improvement. I expect that as we surge his ketones over the next few weeks with this fasting cycle, at least once a week fasting for 36 hours, we're going to see a much better peak and valley of his hormone production. But John, why don't you give an overview of what's been going on with your testosterone in the last week or two?
But before that, I guess, how many years has it been? It's been a while. When I was first tested by the doctor, and my testosterone was like 90, just under 100, like 98. And I guess the normal range starts at 300. So I was going to the Low T Center, because I do a discount for first responders, and that discount ended. So it'd be cheaper to go back to my doctor.
Mm-hmm.
So I decided I wanted to get a baseline to where I was at, since I've been on it so long, because it seemed to me that here in the last few months, that my testosterone, after getting my testosterone shot, that my estrogen level would spike.
Mm-hmm.
So here recently they tested that, and my estrogen was high. So then they prescribed me estrogen blockers that I would have to take 24 hours after my weekly injection, and then another pill 48 hours after. So twice, 2 pills a week of the estrogen blocker. If I did not take it, then I was a hysterical mess.
Right. It's not fair. It's not fair to watch what happens to this. But so tell me the symptoms of what happens the one time you said you missed it. What went wrong?
Well, I cried like a baby. Little stuff that would happen. I'd watching something on TV, like a father putting his child on the bus for the first time going to school, and I just bawling. And I got tenderness on my and it was not good.
No,
it was
awful.
Definitely something going wrong. And I had to. I think we were at the lake too, and I forgot my medication, so I had to hurry up home.
Run home and say, forget this. Either I'm going to become a boob, or I'm going to literally. So I want to show folks just exactly what's happening there. When you look at the hormones on this slide, you can find that that estradiol and that testosterone are right next to each other. So as they peaked up the testosterone and they kind of skipped all these other steps ahead of time, there's no way to shut off that turning it into estradiol, except to block that. It's called a CYP19A1 receptor. That medicine he takes is specifically targeted at stopping the conversion of testosterone into estradiol. And we use this in breast cancer mainly, and we use it in people who we want to force into menopause because of a sensitivity to the estrogen while treating something like cancer. And I will just say that it is not fair to watch what happens when you give a healthy male a strong dose of estrogen. That is evil by anybody's measure. So you had your labs drawn last week, and you got your results back this morning. What was that?
Correct. So I stopped going to Low T Center 3 weeks ago. So I had 3 weeks with no injections, and I'm at 216 now.
Right. And so do you remember what it was when you were first diagnosed?
It was 98, 90. It wasn't 100. It was under 100. I know that.
Awful.
Yeah.
So, again, the injection they would have given you several weeks ago now, how many weeks did you say it was since the shot?
3 weeks.
Yeah. So that half-life is gone. There's no testosterone in your system that isn't made by you. And although the normal, we love it above 300, we love it above 400, you look at that number of the 200-ish, a little over 200, it's in the rescue zone. So it's something where if you can be really disciplined about these fasts, this 36-hour fast, and then be tolerant of what's going to happen. Your ketones are going to rise. There's going to be a couple of sleepless nights ahead until your body kind of adjusts to this. But the supply, just like we're trying to supply Jennifer her supply of hormones by improving her ketones, by surging your ketones, you are supplying your system with an improved growth hormone, an improved testosterone, and again, the most powerful part that I can't emphasize enough, it's so hidden in the delivery of when I give a patient a shot, it will be a very steady level of testosterone. When it's supposed to be up and down and up and down and up and down, constantly up and down and up and down, it is a pulsatile hormone. And I can't give you a pulsatile hormone. I can give you a steady line. And it makes for a great average. I can improve your average. It will improve, it will replace it. But it is nothing like the beautiful rhythm of what happens in our very regulated hormone system of the human body. And I would contend that your body did that because you told it to. You made so much insulin, you had such high sugars for so long, even though you didn't know it. I'm really confident that happened, especially because you've lost weight so easily with even not a perfect ketogenic diet, but a pretty good ketogenic diet before we then stepped it up a little bit. And I contend that if you can do these 36-hour fasts and then, be that supportive voice for your wife, you're going to have a great last 20 years of your marriage for sure. I just want to tell you that. But
That's good to hear.
maybe however many, God gives you how many years left. Let's make all of them as youthful and as very vibrant as possible. But that means these hormones totally need to get reset. And so as she struggles with menopause and we try to give her this fasting cycle to help her, if we can restore your body to a healthy level as well, what a great gift.
Mm-hmm.
Please subscribe to my channel. And don't forget to click the notification bell so you don't miss out on any new videos. Stay tuned.